I got started on my metabolic health journey through my own struggle with obesity and my own struggle with an autoimmune condition called psoriasis, which affects your skin. I had these starting at the age of 5 and was on and off with good control of my skin and good control of my weight until I was 30, using just dietary restriction. And then in my early 30s, my grandmother told me if I wanted to control my waistline, I should cut out the white stuff. No more bread, no more cookies. So I took her advice and cut out all the starchy foods, not knowing it was low carb at the time, and then going back and studying low carb afterwards, but I've been weight stable for 14 years after taking her advice. So to get completely rid of my psoriasis, and in all clarity, I'm not 100% rid of it. I have it on about 1% of my body at the back of my scalp. But I had to go carnivore for a little while, get very strict, very clean. I did all of my cooking at home. I did not eat out to make sure I knew exactly what was in my food. I did that as an elimination diet and then slowly added back some carbohydrates after my skin was clear and I was successful at coming off of immunosuppressant medicines that were controlling my psoriasis but were also dangerous to be on. So I had to get very clean and very strict.
Okay.
The first 4 years was just a little bit of trial and error, cutting out the obvious starchy things that my grandmother had told me about. And then it was about, 4 years into that, so the last 10 years, I have studied. I went and got a certificate of advanced education with Obesity Medicine Society. I learned a lot about low carb there and then dived further into the works of people like Jason Fung and got connected with Low Carb USA and then later the Society of Metabolic Health Practitioners and furthered my education through them and started using it in my professional practice as a nurse practitioner at that point. So when I think of metabolic health, I think of just the general metabolism of the body. It's our blood sugar, it's our hormones, but then I take it down to the patient level. Metabolic health is feeling good, feeling healthy, being able to be vibrant and run around with your children, being able to go on vacation and walk on the beach. And that is why metabolic health is important to me and why I use it in my practice, specifically the low carb approach, because it helps my patients live to their optimized health and to feel good as they're aging. I was one of the founding members of the SMHP, and when that society was formed, it brought validity to what all of us in the community were seeing, is professionals that were getting serious about helping patients make changes on their metabolic health, reverse their diabetes, reverse their hypertension in a way that I had not seen in my previous, say, 15 years of practice. And when we all got together, it made those individual voices one stronger voice, and then we could advocate together for changes in our patients.